The title of this work is Case Series Pediatric Human T Lymphotropic Virus Type 1 and its Clinical Expression. My name is Ingara James, part of the Department of Pediatrics at Libre University in Cali, Colombia. Juliana Mejia Myrtle, part of the same department. Monica Hilar Tunduaga, it's part of the Department of Pediatrics and Epidemiology at the same university. And Juan Pablo Rojas Hernandez is part of the Pediatric Infectious Disease Department at Club Noel Children's Clinic Foundation and a doctorate student at the health program in Valle University in the same city. There are no conflicts of interest associated to this work. We would like to thank all the patients that have been involved in this project and all their families who have been so willingly involved in the research associated to this disease. As an introduction, HTLV was the first retrovirus to be identified and associated with oncogenic activity. It's estimated that approximately 10 to 20 million people in the world are infected with it. The clinical findings that have classically been associated to this infection has been T-cell leukemia, lymphoma, and myelopathy associated to HTLV infection. Yet most of these descriptions have been done in adults, and there's few studies that have studied the clinical manifestations in children. Most of the descriptions have been associated to dermatologic manifestations, specifically infective dermatitis being the main presentation in children. The purpose of this work was to describe the clinical and demographic characteristics of pediatric patients with HTLV infection. The design was an prospective case series analysis with a collection of medical records and subsequent description of demographic data and clinical characteristics of 16 patients with HTLV diagnosis. The period of collection was between January 2017 and July 2021, and we took a pediatric population that attends the reference hospital in Cali, Colombia, which is in the southwest region of Colombia. The results were a total of 16 patients that we found with infection of HTLV. 9 of them were men, 7 were women. 13 of these patients came from the Pacific Coast, 9 with nutritional deficiencies, and 9 with hematological findings. Of the main finding was microcytic normochromic anemia. 8 cases presented with respiratory symptoms, all of them taken to bronchoalveolar lavage, 2 of them with the diagnosis of pulmonary tuberculosis, and 4 of them with the diagnosis of pulmonary aspergillosis. There were 2 patients that had concomitant infections, one with toxoplasmosis, leptospirosis, dengue, and malaria, and a second patient with intestinal parasitosis and soft tissue infection by Streptococcus pyogenes. The dermatological compromise, 7 patients presented this finding, 5 of them with infective dermatitis and 2 of them with overinfection by scabies, and 4 patients had autoimmune compromise. The patients gathered in the study were classified in clinical findings by organ system, finding respiratory manifestations as one of the most significant findings, with pulmonary parenchymal damage associated and subsequent possibility of an opportunistic infection. Also dermatological manifestations, as we show with the scabies and infective dermatitis, and the expression of autoimmune disease. So far, no clinical manifestations were suggestive of T-cell leukemia or lymphoma or myelopathy associated to HTLV infection. As a conclusion, the different clinical findings in children with concomitant infection with HTLV broadens the panorama to suspect this disease. There are more studies that are required to achieve a direct association between structural lung damage, autoimmune disease, and immunodeficiency associated to HTLV infection. But what we aim with this study is to raise interest and awareness of the disease and the impact that it could have in the pediatric population. Thank you very much.